We are here at AANS in Boston. My name is Carlos Pisuoco. I work at Leica Microsystems, and I'm here with Dr. Prevedello. Can you please introduce yourself?
Absolutely. So I'm Daniel Prevedello. I work at The Ohio State University. I'm one of the neurosurgeons that specialize in skull-based surgery at the department, director of that unit.
Can you tell us a bit about your experience with MyVeo and GLOW800?
Yeah, so we started with the ARveo technology with a lot of characteristics that really allow us to do very good quality neurosurgery and also very good for teaching, in my opinion. A student can be in the same room using the MyVeo and really appreciate in real time in 3D what the surgeon is doing.
In which specific application you have found MyVeo beneficial?
That's a very good question. I specifically think that is very helpful in complex cases. Cases where the patient is positioned in sometimes awkward angles. There is a learning curve because you look it in an angle and your visualization is the same as the main surgeon optics. But that situation allows really two surgeons to operate together like in harmony there, both seeing proper 3D. That's one of the advantages. The other that I noticed on the same type of case, MyVeo really helped in ergonomics, in my opinion, because I was able and I being able to stand up and really in a normal posture perform the procedure, seeing 3D through MyVeo without the need to kind of drop down and look it through the optics. So that's one application that for me was like I was ecstatic. I was so happy the day that I could do that.
Thanks a lot. I mean, we are talking about surgeries that takes a long time. And let me ask you a question. Wearing MyVeo, how was your interaction with your colleagues and the operating theater staff?
So the main advantage is the fact that you can still see the world around you, right? So when you look straight, you're seeing the surgical field in 3D, but you're still seeing the staff around, so you don't feel like locked in to the technology. And you can ask an assistant to elevate in case you need to do any work that you want to do in parallel in a surgical table. There's a learning curve, but I believe we adapted very well.
Fantastic, fantastic. Based on your experience, can you tell us a bit more about the advantages in using MyVeo and GLOW800?
The fact that with MyVeo now, I can see exactly what my fellow or my chief resident is doing allows me to have more confidence. It's like, okay, I see what this person is doing. And further, I realize that I can actually assist better by seeing 3D, the same view that they are seeing. So with that combination, it really allowed us a next level of teaching in the operating room in these complex cases that we do.
Thank you very much. What about the GLOW800 experience you had?
Yeah, so that is very good for the vascular perspective. So we have tumors that go 360 degrees around vessels, and we're looking for perforators and identification of where this vessel is going. So that is a technology that we use, the GLOW800 very often, and allows us to see where the vessels are. We also use for vascularized reconstruction to confirm that the reconstruction is viable.
Fantastic. Thank you very much for all these tips that you have shared with us.